Okay, cool. Professor or Dr. Marty had mentioned that I'm able to sit down when I'm recording this because it cuts off like half my body when I'm filming. Oh gosh, this isn't gonna work. I think this is better. This better? Nope. I think this is good. Okay, there's my feet. And it's easier for this dude. So, let's get started. Whew. Knock, knock, knock. Hello, my name is Taylor Grisham, and I'll be your student nurse today. So I'm here to do a head-to-toe assessment on you. It should take about 20 minutes, could be a little longer. Is this okay with you? Great. This head-to-toe assessment is just to make sure that you are healthy and well physically. So you still believe that this is okay? Great. I'm going to move him over here because he needs a backboard or something. Okay, great. So I'm going to perform hand hygiene. I'm going to provide privacy for my patient by closing the curtain. Can you please tell me your name and date of birth? Great. So do you have any, or I should say that my patient's name and date of birth does match up with what the computer states. Do you have any allergies that I should know about that may not be listed inside of the computer? Great. So the patient actually does not have any allergies. On a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt, what is your pain level? Great. My patient does not have any pain. Okay. I see no signs of acute distress. I have itchy nose. All right, I'm performing hand hygiene again. I see no signs of acute distress. Looking at my patient, from speaking to him, I see no signs of slurred speech. I see no signs of drooping with the face. The behavior is appropriate to his age. The patient does seem a little nervous, but that is anticipated when coming to the doctors or the hospital. I see no off facial expressions, no confusion. It seems like the patient knows what is going on. Can you please tell me your name, your date of birth, where you are, and why you are here? Great, thank you. So this proves that the patient is ANO times 4. I'm now going to look at the patient's skin. So for the computer states that the patient's skin, that the patient is Caucasian, which means that the patient's skin should be white, and the patient's skin is white. So looking at the skin, I see no signs of lesions, wounds, incisions. I'm now going to palpate the patient's temperature or skin temperature. All right, great. So the patient's skin is warm and dry, just like my eyes. They're very dry. Looking at the patient's nails, they are pink. They are round. I see no sign, or I'm now going to test for capillary refill. Great, so capillary refill is 1 to 2 seconds. Mr. Bayer here is 2 seconds, which is within range. So now I'm going to look at the patient's facial structures, make sure that they are symmetrical with one another. And by looking at the face, I can see that they are symmetrical with one another. I'm now going to palpate the head, feel for any incision or lesions or infestations. I see no signs of lesions or infestations. Okay, I'm now going to test cranial nerve 5. Cranial nerve 5 is the trigeminal nerve. I'm going to have the patient take his mouth, close his teeth, and grind them together softly. Can you do that for me? Great, thank you. After this, I'm going to test the sensory function. I have my invisible cotton ball here. I would have the patient close his eyes, and I would have him tell me if he can feel it and which cheek he can feel it on. I'm now going to test cranial nerve 7. Cranial nerve 7 is the facial nerve. I'm going to have my patient puff up his cheeks like this. Great, thank you. So this proves that the motor function of cranial nerve 7 is intact. Now I'm going to test cranial nerve 11, which is the accessory muscle. I'm going to have my patient shrug his shoulders. Great, thank you. And can you turn your head like this? Okay, great. So by doing this, I can say that the patient can turn his head, rotate his head bilaterally, and cranial nerve 11 is intact. Now I'm going to look at the eyes. I'm going to look at okay, I'm looking at the eyes. Looking at the eyes, I see no signs of redness or discharge. I'm going to look at the conjunctiva and the sclera. Sorry, when I close my eyes, I'm thinking about what is next. The conjunctiva is pink and moist. The sclera is white and moist. Yes, in both eyes, the conjunctiva is pink and moist, and in both eyes, the sclera is white and moist. Okay, great. So now I'm going to make sure that the eyes are perla, which is that the pupils are equal, round, and reactive to light and accommodation. So look at the eyes. I can tell that they are round. I'm going to measure with my pen what size they are. So by looking at it, I can say that they are about 4 millimeters, which is within range. The range is 3 to 5 millimeters. So the eyes are equal. The size is 4 millimeters, and they are round. Both eyes are 4 millimeters. So now I'm going to test, make sure that they are reactive to light. Great. Great. So whenever doing this, shining the light in one eye, both eyes constrict. I'm now going to test for accommodation. Okay, I would like you to follow my finger and my finger only with your eyes only. Great. So this proves that accommodation is intact. The eyes went to the nose. Okay, so this proves that I'm going to perform hand hygiene. This proves that the eyes are perla, which means that that the pupils are equal, round, and reactive to light and accommodation. I'm now going to perform the six cardinal fields of gaze, and this will prove that cranial nerve 3, 4, and 6. That's it. 3, 4, and 6 are intact. All right, so I would like you to follow my finger, and my finger only, and wherever it goes. Keep your head straight with your eyes only. Great. Great, thank you. So now I'm going to inspect the ears. Looking at the ears, I see no signs of redness or swelling or any discharge. I'm going to test cranial nerve 8. Yes, I believe it is cranial nerve 8. I'm going to test cranial nerve 8 by doing the whisper test. I'm going to have my patient close his eyes, and I'm going to whisper something into his ears. Oranges are my favorite fruit. Oranges are my favorite fruit. The Cardinals lost yesterday. I don't even know if the Cardinals played. I'm not a big sports person. It's just the thing that came to mind. Okay, so looking at the nose now. Looking inside the nose, I see that that is symmetrical. I see no signs of asymmetry. I see no signs of inflammation and no signs of deformities. I am now going to look for any drainage. Looking at this, I see there is some drainage, but this is just because it is cold outside. I'm now going to test for bilateral patency. Okay, with one finger, can you close one nostril and breathe in for me? And do it with the other one. Great, thank you. Okay, so with that being said, I can say that the nose is, there is some drainage in the nose due to the cold, and bilateral patency is intact. Now I'm going to move on to the mouth. Looking at the lips, I can say that they are pink and moist. I'm going to look inside the mouth now. Looking inside the mouth, I can see that the tongue is pink and moist, and the gums are pink and moist as well. I see no signs of missing teeth either. I'm now going to assess cranial nerve 9 and 10. I'm now going to test cranial nerve 9 and 10. For 9, that is the glossopharyngeal, so I will have my patient swallow for me. Can you please swallow for me? Great, thank you. And then for cranial nerve 10, it's the vagus nerve. Can you please stick out your tongue and say ah? Great, thank you. I'm now going to test cranial nerve 12. That is the hypoglossal cranial nerve, and I'm going to test that by having the patient stick out their tongue and do some movement. Just move your tongue around like this. Great. So now I'm going to look at the chest. Well, before I get there, I should mention that by testing those cranial nerves, I can say that they are intact. Now I'm looking at the chest. I see no signs of accessory muscle use. I'm now going to listen to the lungs. I'm going to start with the upper. Oh, I should have these. I'm going to start with the right upper lung. All right, starting with the right upper lung. Going to the left upper lung. Going to the left lower lung. Going to the right middle lung. And then going to the right lower lung. Okay, great. So now I'm going to listen to it posteriorly. Posteriorly. I don't know how to pronounce that. I'm just going to use my left hand. Okay. So by doing this, I'm going to start with the right upper lung. The left upper lung. The left lower lung. The right lower lung. The right lower lung again. And the left lower lung again. Yeah. Okay, great. I hear no signs of wheezes or crackles. Yes, I hear no signs of wheezes or crackles. So the lungs are clear. I'm now going to palpate the carotid pulses. That's what I was going to do. Alright, I am going to do this one at a time because you do not want to palpate the carotid pulses at the same time. It could block blood flow to the brain. Great. Okay, so doing this, I can say that the carotid pulses are 2+ bilaterally. I'm now going to assess for edema. Great. Great. So I see no signs of edema. This could be caused by heart failure. Now I'm going to, oh my gosh, my phone is at 10%, sorry. I'm now going to listen to the chest with my diaphragm first. I'm going to start with the aortic, the pulmonic, Erb's point, tricuspid, and mitral. Great. Now I'm going to use my bell. Great. The aortic, pulmonic, Erb's point, tricuspid, and mitral. Great. So S1 and S2 are noted. I hear no signs of S3, which could indicate a heart murmur. I'm now going to palpate the radial pulses. Wait, did I just? Yeah, okay. Yeah, okay. I'm going to palpate the radial pulses. I'm going to start with the right. Great, and I'm moving on to the left. Great, and now I'm going to compare. Great. So the radial pulses are 2+ bilaterally. They are strong. Now I'm going to test the pedal pulses. I'm going to start out with the dorsalis pedis. This hair is making my eyes all dry. I went down from the great toe. Great. Both the right and left pedal pulses are 2+ bilaterally. Now I'm going to feel for the that was the dorsalis pedis. Now I'm doing the posterior tibialis. All right, posterior tibialis. I'm feeling, and the other side. Great. Great. So now the dorsalis pedis, the dorsalis pedis is 2+ bilaterally, and the posterior tibialis is 2+ bilaterally as well. I'm having a hard time right now. Now I'm going to ask the patient to lay down. I'm going to examine their abdomen. While looking at their abdomen, I'm going to look at the contour and the symmetry. By looking at the stomach, I see no signs of anything that's asymmetric. The contour, the ribs are higher than the stomach, but not too much, because if the ribs were way higher than the stomach, it could be a sign of anorexia. I see no signs of anorexia or signs of obesity or being overweight. The belly button is midline, and the ribs are on the sides of the body. So the contour is I see the contour is good, and it is not asymmetric. Yes. Okay, now I'm going to palpate, now I'm going to auscultate the bowel sounds. I'm going to listen. I'm going to start with the right lower quadrant, moving up to the right upper quadrant, the left upper quadrant, and the left lower quadrant. Great. So if I heard no bowel sounds, I would listen for 5 minutes straight. Now I'm going to palpate. I'm palpating the right lower quadrant. Let me know if you feel any pain. The right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, great. Did you feel any pain? Great. I felt no tenderness or ostension when palpating. All right, you can get up for me. Now I'm going to move on to the joints. So I'm going to do the minor and the major joints of both the upper and lower extremities. So with the upper extremities, I'm going to start with the minor joint, which is the wrists. So looking at the wrists, I can say that they are symmetrical with one another. The contour is equal to one another. I see no signs of swelling. Can you please do this with your wrists? And then the patient would do that. That proves range of movement. So now I'm going to test the major joint in the upper extremities, and that is going to be the elbows. Okay, so looking at the elbows, I see no signs of asymmetry, and the contour is equal with one another. I see no signs of swelling. Can you please bend your arm like this? Both of them? Okay, great. The patient then would do that. And that proves that the elbows have range of movement as well. So for the lower extremities, I'm going to do the ankles and the knees. The ankles are going to be minor, and I'm going to start with them first. So the minor lower extremities, the ankles, I'm going to compare them, and I see no signs of, I see that they are symmetrical with one another. I see no signs of, oh my gosh, what am I saying? I can tell that they are symmetrical with one another. I see no signs of swelling, and they are equal with one another for the contour. The contour is equal with one another. Can you please bend your foot like this and maybe turn it to each side? And then the patient would do that. Now I would state that range of movement is intact for the ankles, the minor joint. Now I'm going to have the patient lay down when I'm testing the knees. Looking at the knees, I see no signs, or that I see that they are symmetrical with one another. The contour is equal with one another. I see no signs of swelling. Now I'm going to test for range of movement. Going to take the foot and bend it up. Do you feel any pain? Great. And bend it up. Great. Do you feel any pain? Great. So I see the range of movement is intact for the major joint of the lower extremities. This proves that all upper and lower extremities for the minor and major joints that I have chosen are symmetrical with one another. With the joints, with like the wrists are symmetrical with one another, the elbows are symmetrical with one another, and so on, with the contour as well, and they all have range of movement. Now I'm going to test the sensory function of the lower extremities. So I would take something that I could touch the foot with, see if their toes moved. Great, and also see if they felt it. I'm now going to test for the muscle strength test. I'm going to start with the upper extremities. I'm going to have the patient push on my hand. Great, and the other hand. Great, and then together. Great. So now I'm going to do that same thing with the foot. All right, push your foot against my hand. Great. Other foot. Great, and together. Great. So this proves that muscle strength is intact for both the upper and lower extremities. My bear looks like it has a problem walking, so I'm just going to state what I would do with a patient when assessing their gait. I would ask the patient if they felt comfortable walking in front of me, and if they are able to walk after doing that. If they said yes, I would have them walk in front of me. I would be looking at if they are tripping, leaning, limping, their width of their hips, make sure that they are equal with one another, make sure they're equal with their shoulders. And I would make sure that they are able to walk and their gait as well. That's how I would assess gait. So now I am going to reassess your pain level. Okay, can you please tell me on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you ever felt, what is your pain level? I wouldn't hit my patient. Sorry, I'm just excited. The patient has no pain. Is there anything else I can do for you before I leave? Great. I would make sure that the bed is in the lowest and locked position. I just said it, but I'm going to make sure that the bed is locked as well. I'm going to make sure that the side rails are up. I'm going to make sure that the call light is within reach. And I would like to say thank you for letting me perform this assessment on you today. No problem. Okay, and I'm going to perform hand hygiene. Oh gosh, my patient just fell. All right, I'll see you later.